Now we can move to Neumann system model. The Betty Neuman, that is in 1972. This is the founder, the person, the person behind this particular model was called Betty Neuman. All right, let us see who is now in this particular call. David Wafula. No, before David Wafula, we have got Clinton Omboka. Clinton Omboka, are you in this call?
Yes.
Okay, you can
So
share.
number 4. Okay, Neumann system model. That is Betty Neumann. That is in 1972. Core concept: client brackets individual, family, community is an open system interacting with internal and external stressors. Model components: we have 5 variables. That is physiological, psychological, social, cultural, developmental, spiritual. Lines of defense: we have a flexible line of defense, normal line of defense, lines of resistance. Stressors: we have intrapersonal, interpersonal, and extrapersonal. Nursing interventions: we have 3 of them. So let's start with primary prevention, that is reduce risk factors before illness, e.g. immunization. We have secondary prevention, that is early detection, e.g. screening. And tertiary prevention, that is rehabilitation and adaptation. Applications: number 1, disaster preparedness in community health. We have holistic assessment of populations. Then we have developing preventive nursing strategies. Strength: strength is to focus on prevention and systems thinking. Thank you.
Thank you so much, Clinton Omboka. So Neumann system model, the sender, the core person here is the person. You know, in nursing, we have got around 5 paradigms. But basically, let me just narrow to ourselves the individual, the patient. The patient here is the central person that Newman was talking about. And in the individual, we have got the internal issues that we normally look at, the internal resistance. That is the immunity that you are having. So we normally talk of uh, let me talk of around 3 lines, 5 whatever lines of defense. So we have got flexible line of defense, the normal line of defense, and lines of resistance. So that is to the patient. So this particular model basically was talking about the paradigm of an individual in relation to defense. We are talking of the internal defense and the external defense. But as much as we have got the external defense, we have got some factors, and these factors we normally refer to them as stressors. So we normally talk of the interpersonal, and extrapersonal stressors. Now, looking at this particular model as you are able to defend yourself. Now, the way you are training here as a BSN, as a community health nurse, at the end of it, how will you be able to assist this particular individual in that particular community? Now, that is what you are referring to, level of disease prevention or nursing intervention. Now, at the moment, there is an additional, apart from primary prevention, secondary prevention, and tertiary prevention, we have got 2 other preventions that are there at the moment. So before primary prevention, we have got what you call primordial prevention. Now, primordial prevention is when we signal, like the government will just talk of, let me talk of, you see, smoking, maybe cigarette is, you see, creation of awareness. I hope we are communicating. Before primary prevention, we have got those particular hazards, or like they are like indicators, danger signs. So that is what we are referring to primordial prevention. Now, after primordial prevention, we normally look at the primary prevention, secondary prevention, tertiary prevention, and then another cap that is missing in this particular model is what we call quaternary prevention. Now, quaternary prevention goes beyond rehabilitation and adaptation. Now, it's about home visiting. It's about counseling that is beyond tertiary prevention. So I hope we are getting that particular concept. So we have got 5 levels of nursing prevention: primordial, primary, secondary, tertiary, and quaternary. So application is about disease preparedness in the community, holistic assessment of population, developing preventive nursing strategies.